ಆಗುವಂತೆ ಆಗಿದೆ. ಅವಕಾಶ ಸಿಗಬೇಕು.
ಜಾರ್ಜ್
ಒಂದು 4 ಜನ ಹೋದ್ರೆ ಸಾಕು.
A pleasant evening, dear Bishop, dear fathers, sisters, and my dear brothers and sisters. A humble request to one and all the participants, please kindly mute your audio. Please kindly mute your audio so that there is no background disturbance. Once again, a pleasant evening to you, dear Bishop, dear fathers, sisters, and my dear brothers and sisters. We are in the difficult time
would you like to attend?
Of the second wave of the deadly COVID-19 pandemic. In this regard, the diocese and the bishop thought it would be apt for us to have a session to make ourselves positive or to have a positive attitude during these difficult times. And as such, as we begin this webinar, let us offer this evening to the Lord, the deadly COVID-19 pandemic. Let us offer this to the Lord and begin this webinar with a prayer. I request all of you to kindly mute your audios and spend this evening listening or participating in this webinar.
Pura kapsalanım devrini.
You are with me wherever I go. Every moment your life in me flows. You're always there, close by my side. You are there, oh Lord, both day and night. You were with me in my mother's womb. You are with me in my days of gloom. You helped me stand against all odds, and you filled me with your strength, oh Lord. You are with me wherever I go. Every moment your life in me flows. You're always there, close by my side. You are there, oh Lord, both day and night. In times of sorrow and in times of grief, you gave me hope, strengthened my belief. When I did fall and was in pain, Lord, you set me on my feet again. You are with me
Let us spend 1 minute in silence, remembering all those who have lost their fight against this COVID pandemic. Maybe our own family members, maybe our own community members, maybe the people whom we know. Let us offer all of them into the hands of the merciful Lord and pray that the Lord, good Lord may grant them eternal rest. Thank you, one and all. During these difficult times, as we know, all of us are busy in one way or the other. In spite of our busy schedule, it is better for us to spend some time reflecting on our own life and maybe our own ministry and see in what way we can remain positive or strengthened during these difficult times. Our bishop thought it would be apt for us to have a session of this kind so that during these difficult times, we remain positive, we remain focused on our ministry. So this way, it is the result or fruit of Bishop's discernment and Bishop's planning that this evening we have this webinar. And as I extend a warm welcome to all of you, now I request the Bishop to give the keynote address and set the tone for today's webinar. Over to you, Bishop.
My dear friends, I am happy and grateful that this webinar on the resilience of the mind has been organized, especially in troubled times like these, when the pandemic is causing so much insecurity, uncertainty, anxiety, fear, grief, pain, and loss. With such a qualified, competent, and experienced resource person, I am sure this webinar will be informative, instructive, interesting, and inspiring. I would have preferred a webinar concept of resilience as that of the body, mind, heart, and soul. But for our purpose here, the resilience of the mind would suffice. Caught up almost by surprise in the whirlpool of the raging pandemic, we all need the capacity to rebound from adversity and cope with change. We need determination and persistence, capacity to develop alternative solutions, and to care for ourselves, others, and nature with empathy. We need to go out of ourselves in order to help. We need to compromise, giving others the benefit of the doubt, and be humble enough to seek help when needed, have the ability to self-soothe and self-regulate, be willing to admit and learn from mistakes, accept instruction and constructive criticism, build up optimism and hope for the future, have a sense of humor, believe that things can get better, be playful, creative, and willing to explore, tolerate frustration, be flexible and adapting change, have spirituality and a sense of higher purpose, feeling that we are lovable, understanding, and our life has value, dedicated ourselves to self-improvement and appreciating cultural heritage and traditions. For all this, we need to look after our well-being and the well-being of others. Learn to deal with pressure and reduce the impact of stress on our life. In other words, develop emotional resilience. Of course, we need the resilience of the body, of the mind, of emotions. But we also need the resilience of the spirit. So we make some lifestyle changes, look after our physical health, take a break, and build our support network. But then, what about our spiritual health? Well, as a religious person, I would emphasize the importance of meditation. It is not a complicated exercise. Everyone can do it. Take some time every day. Sit relaxed, breathe in and out deeply. Take a mantra or a word or the name of deity and repeat it with every breath. Slowly and imperceptibly, you will experience tremendous inner calm, peace, strength, hope, optimism, and joy. That is resilience. That is spiritual resilience. Have a rich, reflecting, refreshing, rejuvenating, and a relaxed evening. God bless you and keep you safe. Thank you.
Thank you, dear Bishop, for setting the perfect tone and explaining or giving the real purpose or explaining the real purpose of today's webinar. Dear friends, today we have an eminent person, an eminent speaker in the person of Dr. Aravind S.T. If I had to present his complete CV, it might take at least 10 to 15 minutes, but briefly let me introduce the resource person of the day. Dr. Aravind S.T. is MRC Psychiatry from London, UK, and DPM and MBBS. So he had his education, MBBS from JSSMC, University of Mysore in the year 2001. Then he did his DPM from Father Muller's Medical College Hospital, Mangalore, in the year 2005. Then he had his higher education, MRC Psychiatry from Royal College of Psychiatrists in UK in the year 2009. He is ex-speciality registrar, Ealing Hospital, London, and High Secure Forensic Psychiatry Hospital, Rampton, Nottinghamshire, NHS Trust, UK. Among his achievements, I would say he has 16 years of experience with 5 years of experience in psychiatry experience, 5 years in UK. Then he is an academic topper at CASC MRC Psychiatry exams, West London, Mental Health, NHS Trust, Royal College of Psychiatrists, UK. He is a state rank holder in DPM, Rajiv Gandhi University of Health Sciences in the year 2005. He is an eminent speaker, a prolific writer, and he has given maybe numerous lectures or talks on mental health and related topics. He is a topper at West London NHS Trust, UK. So there are quite a few awards and honors. Among his hobbies, he likes traveling, he likes cricket, he likes movies, he likes motivational books and autobiographies. In fact, he has helped SMSSS in the past with at least 7 or 8 talks for different groups of people. So I felt he's an apt person for us today, this evening, to address on the issue resilience of mind amid COVID. So I now pass on now I request Dr. S. Arvind ST to take over the session. Dr. Arvind ST, welcome to you.
Thank you, Father. Thank you, Father Roshan Pinto, for that generous introduction of me. And I thank Bishop Francis Ciario for setting the tone for this webinar. And I welcome all the participants for this webinar, for this important webinar of resilience of mind amid COVID. Today, we are living in a very uncertain world. We all know that the life was totally different when the pandemic hit us. Early in January 2020 also, probably we never knew that, we just heard some news that there is some viral infection going on in China. Then later on, some visuals started coming up. And there was a first case noted in Kerala in India. And even then we are all sort of not that much worried that, okay, it might be just a flu and all, and we'll overcome that. Later, the scenarios become so serious, so difficult, that it started spreading to cities, metros, villages, and people. We started hearing new terminologies like quarantine, sealed down, and you have to have this oxygen beds, ICUs, and the PPE kits. Even doctors were not prepared, the administration was not prepared, the government was not prepared, and this pandemic hit us in a very bad way. And, this pandemic, we saw our first wave of the pandemic in last year, and now the second wave has come up with more virulence, more deaths, more mortality. And the impact which it is having on the life of people, on the minds of people, is huge. Why? Because we can see that in India, probably daily around more than 4,000 people are losing their battle to COVID, they are dying. And lakhs of people, almost like we touched almost 4 lakh cases per day. And what is the impact of this? You are losing almost 4,000 to 5,000 people per day. So somebody is losing their wife, somebody is losing a mother, somebody is losing their father, people are getting widowed, people are getting orphaned. And there are certain cases where the government has to come up with some directives, that is advanced directives, that what if the both parents die, whom should the kids go to? Whether it's go to the relatives and who is the next of kin. So we are discussing in that kind of a scenario where we never heard of in our lifetime, not in this decade or not in this generation. So this is the impact, because when I was working in UK, people used to talk about World War II, where the World War II happened probably 50 to 70 years ago, but still people are having that impact, the socio-emotional impact of World War II on their minds still now. So probably this pandemic will have an impact on our lives, on our minds currently, as well as generations to come. So resilience of mind is, as bishops are told about, like he was right in saying that it's a capacity to rebound from adversities, the embrace change, and ability to be happy even after something really going bad or really something going unexpected. So it all depends on person to person, their mindset, their personality, and their mental health. So the importance of mental health can be termed in terms of like WHO's definition, the World Health Organization definition, that health is a complete state of physical, mental, social, and spiritual well-being. That is not just the absence of disease or infirmity. We all focus on our physical health, that I don't have hypertension, or I don't have diabetes, I don't have arthritis or cancer. But we never think of whether I've really got depression, whether I've got anxiety, whether I'm working to my full potential. Can I dream something great in life? Can I achieve something which others are unable to do it? Can I accept the challenge in life? What something goes really wrong, how I will be able to cope with that? That is the mental health aspect of it. Why I'm focusing on the mental health? Because According to WHO, World Health Organization, yearly, almost 8 to 9 lakh people commit suicide every year. This is the official data from the WHO. And when it comes to India, according to NCRB, that is National Crime Record Bureau, nearly 1,38,000 people committed suicide in the past year. And among them, every 55 minutes, one Indian student is committing suicide. And if you take the global rates, every 40 seconds, one person is committing suicide, and every 3 seconds having a suicidal thought. So this was all before the pandemic, this data, what I'm trying to say. But with the pandemic, probably the data will come in the next year. It is going to increase because we are seeing people, the doctors who are probably well qualified, who have seen deaths in front of their eyes because they treat terminally ill patients, cancer patients, people who are having kidney failure or liver failure or brain damage, hemorrhage. They used to see deaths in front of their eyes because as a medical student, we tend to see those things, critical patients from our final year MBBS. Then we do work in night duties and all accident cases, all this. So you see deaths, but you don't become immune to that. You still have that heart, but you need to be very professional in how you handle it. But the current scenario is such that every day you go to your wards, every day you go to the ICU, there are few people dying, few people coming in terminal cases, and it has become having such a deep impact on a professional who is very strong in his mind. They are started committing suicide. We have seen doctors committing suicide. This is all burnout that they cannot handle the situation, and some of them have jumped out of the building and given up the life. So this is the impact that mind can have on our lives. So mental health is the priority. They say no health without mental health. So we need to focus on our mind, our mental health, how our mind can cope up with the change, the pandemic, the depression, the anxiety, the fear, the hopelessness, the worthlessness, negative about self, others, all these things, raging thoughts in mind. What will happen to me, my future, my family? That should be able to be handled by our mind. That we need to understand. But do you think most of the emotions, what we feel, they are disorders or just a range of emotions? That we need to understand, that not all sadness is depression, not all fear is anxiety or phobia, or not all suspiciousness is schizophrenia. So that we need to understand. Or social drinking or social kind of smoking to de-stress themselves, is it addiction? So this we need to understand to disentangle whether the person is suffering from mental illness or is just going through a phase of emotional roller coaster. That we need to understand. For that, what we need to understand is what is depression, what is anxiety, and what is addiction. That we need to understand. The depression means it's a pervasive sad mood. That we need to understand. You're all there, you're all having your mobiles, you're going through your webinars through your laptops or mobiles. How will you react if you lose your mobile? We will all feel sad about it, isn't it? So that sadness is there in your mind, but you still go on to your work tomorrow, next day. You meet with your friends and family, you talk to them. You don't stop living. You don't lose your sleep. You don't lose your appetite. So that is normal sadness. But depression is something way beyond that. Depression is pervasive sad mood, that you're always sad throughout the day, and that is impacting on your socio-occupational functioning. That is, you're not interacting with friends and family, you're dull, you're not talking to them, you're not smiling to them, and you're not enjoying your previous music or your spiritual habits or your sports, whichever you used to like before. That is called anhedonia, loss of interest in previously pleasurable activities. And next is anergia. Anergia is what? Feeling excessively tired. That previously you're energetic, now you're feeling very tired. Then biological symptoms is loss of sleep. The early morning awakening is one of the classic symptoms of depression, that previously used to get up early in the morning, like 6 o'clock. Now you're getting up 3 in the night. You're not able to sleep after, because something is going on your mind. Some of your family member is admitted in a COVID ward. Somebody has come as COVID positive. And this is running in your mind, and you're unable to sleep. You're unable to unwind from that. This is just going on your mind. What if he goes to an ICU? What if he goes on a ventilator? What if he dies? What will happen to our lives if this person is not there? So this will be running in your mind. So that probably is one of the symptom of depression, early morning awakening. And negative cognitive triad. See, there was some person called Aaron Beck, who is inventor of cognitive behavioral therapy. According to him, a depressed mind thinks in a very deviant way, that they'll have negative view about self, negative view about others, and negative view about the future. That you have that cognitive triad, that you don't appreciate your own achievements, you don't appreciate your own goodness, or you don't appreciate your own abilities to cope with the problem, and you don't trust your neighbors or your friends or family. You just feel that they're all trying to counsel me, or they're just trying to say some good words to me to make me feel good, but they don't really intend to do it. So this is the psyche of a depressed person. And he might have not have any sort of like, hope for the future. He might feel worthless about himself and hopeless about the future. He might see that what is the point in living? We are all going to die. What if I give up today itself? These kind of thoughts will come to his mind. And these kind of negative thoughts and biological symptoms and suicidal thoughts, if it's running for more than 2 weeks, then the person is definitely in depression. So that is the syndromal, spectrum, the symptom spectrum of depression. So that is the major cause for majority of the misery, the suicides which is happening in our world, because depression is the second largest disease in the world after heart diseases. So this is the kind of impact that depression has in our lives, that we need to understand. The next thing is probably the anxiety, which we are all going through currently, that there's a lockdown, we are not allowed to go out, and we are now heard about wearing face masks, all this, sanitizing ourselves, keeping a distance, and getting ourselves tested for COVID, getting vaccinated. All these things are new. So I get calls from patients that, should I get vaccinated, or I am taking these medications for my heart disease or my mental health disease for anxiety, should I get vaccine? They have heard some negative news that if you take vaccine, something is wrong is going to happen. Or if I go myself tested, if I'm going to be positive, they will seal down my house, or it will have a stigma in my neighborhood. So how should I deal with it? And the fear of, if I get positive, what will happen? Some people will have a catastrophic thinking, that is extreme negative outcome or extreme negative thinking about any situation, that if they have a little bit of chest pain, they'll feel that I'm going to die of heart attack. If they have a headache, they might feel that I'm going to have a cancer. So this is the extreme negative thinking. The same thing in COVID is that they'll feel that if I test positive, I'll definitely run out of my breath, I'll run out of my oxygen in my body, I'll need ventilator support, and probably I might die. So this is the thought, because every day they're seeing the television, they're seeing the WhatsApp messages or Facebook messages that these many lakhs people are tested positive, these thousands of people are dying, and this number is going up and up. And this is like watching a cricket score, that these many wickets are down, this is their score. So people have become obsessed with that. And the way our media is portraying it in a very sort of like in a panicking situation, that there's some anxious provoking background music is there, some light is there, coronavirus is flying all over the screen. They'll try to create, some of them are trying to create panic, and some of them are really educating people. So that is more important, that awareness about a disorder, awareness about the situation is more important than just creating panic. So with all this background, people are getting anxious. The anxiety is what normally we have some mechanism called, whenever you are faced with some new situation, or a situation which you have not seen before, or a fearful situation, or a challenging situation. For example, we're all sitting here, suddenly if there is a snake next to your feet, or if there is a fire, probably nobody will be sitting the webinar, everybody will run off, isn't it? So that is how it comes, that previously if there was no situation, we would take a couple of minutes to get up from our chair and go out of our rooms. But if there is a snake or if there is a fire, there is an immediate response within our body and mind that is called, fearful response. That's an emergency response which our body is known to create. Whenever there's a anxious provoking situation, our body releases a hormone called cortisol, which is released from our adrenal glands. And this cortisol will activate our autonomic nervous system. It will make our heartbeat go fast, and it will start our breathing rapid, and you'll have a churning sensation within your tummy, and you'll feel that if I don't move now, I'm going to die. So this is the situation. So this emergency response, which should be coming only when there is a very negative situation or very situation where you might die, that situation, that hormone is getting released just by seeing the television, news, or going through WhatsApp messages. Because I get a lot of patients who say that, my neighbor died, one of my relative died. Now I am having, breathlessness. Now I am feeling that my heart is heavy. I should go and myself tested for COVID, or get myself ECG or echo done, because there is a fear in the air that, something has happened to him. The same thing might happen to me. That fear is there, that anxiety is there. But how do you call it as a disorder? This is a normal response. If somebody dies or you hear something very negative, you might also feel anxious, but that doesn't stop you from working. That doesn't stop you from interacting with people. You won't lose your sleep or appetite. But when you have an anxiety disorder, you'll start having that repeatedly. Suddenly there is a panic attack. That what is the symptoms of panic attack? Suddenly you will start having pounding heart. The heart goes very fast. 60 to 100 is a normal heart rate. You might, if you check your heart rate, probably it might be beating at a rate of 120 per minute. Or you might be hyperventilating, that you were breathing so fast, you are unable to sleep. There was a person who is an NGO. Last year, he provided food kits to so many people in their village and other places. But this year, he is so fearful that one of his close relative died. After that, he's unable to sleep at all. He's having so much of panic attack that night he keeps on checking his pulse. He keeps on checking with the pulse oximeter whether I'm breathing, whether oxygen is there in my body. That fear of death has gripped his mind. So that is really anxiety disorder, not just, feeling anxious for a few seconds or few minutes and then overcoming with interacting with people, getting solace with talking or ventilating. Anxiety disorder is again persistent, that throughout the day you are having these thoughts, fear that something is really going to happen. So usually our body responds in three ways: fight response, flight response, and freeze response if there is any challenging situation. If the flight response is you run away from the fear. Freeze response is you don't know what to do about the situation. And the fight response is appropriate mode of action which we need to take. That is the action we need to come across. So that I'll come in the solution aspect of this COVID mental health related issues. So there are situations, the COVID, how it is impacting on our lives, that it is creating more depression, more anxiety, and people are trying to cope up with this anxiety and depression or paranoia about COVID disorder in different ways. About this paranoid behavior or suspicious behavior. Last year, I had a patient who is a pharmacist from one of the talukas of Shumaga. He's a pharmacist and he's working in the PHC. He came in an acute state that he's unable to sleep. He's so fearful, he's paranoid that if I wear a mask, I'm going to die. That is the delusion he's having in his mind. What is delusion? The definition of delusion is false fixed belief, even on evidence to contrary. Even if you say to that person, no, you won't die, there is no deficiency of oxygen if you wear mask, he won't believe you. He just fears that if I wear mask, I won't get oxygen, I'm going to die. This is the situation where he came in, that he was so psychotic, that is so delusional, that even if you try to relax him with words and counseling, it was not working for him. We really had to admit him, we had to give some medications and injections then to reduce the dopamine levels in the brain. Then he was a little bit okay. So that is called delusion or psychosis. And some people try to deal with depression, anxiety, and this kind of fear, obsession, psychosis through various other means. We have got various solutions for that, but some people tend to take it in a different way. They feel that drinking alcohol or smoking cigarettes or drugs can reduce their anxiety and stress. So people try to get addicted to certain substances because they try to start with small dose of alcohol, maybe 30 ml or 60 ml. Gradually it is addictive in nature. Your mind and body asks for more. So you start with 30, 60, then you go for 90, 120, and if you stop it, you are unable to sleep. So that is the addiction which happens. So that we need to understand that that is not the proper way of dealing with your depression or anxiety. Or some people try to ventilate their anxiety or depression through aggression. They'll become irritable towards their family members or friends. There was a rise in domestic abuse and violence during last year's lockdown. A survey has been done by the Social Welfare Department that throughout India, domestic violence, abuse, physical and verbal and sexual abuse towards women during the lockdown had increased because the frustration of not getting, losing the employment, not having enough finances, and not able to sort of like go to work or having problems with your mental health, is they are throwing away their frustration on their near and dear ones. So these are the aberrant ways of coping with the COVID related mental health issues. So how can we deal with it? So first and foremost is prevention aspect. Let me focus on prevention aspect, then we'll focus on the solution aspect, and later I'll cover about how to counsel the persons, and later we'll have some discussion. The first and foremost is, as we all know, but some people tend to sort of like, not follow it properly. That we need to understand that you need to wear a mask. That is the most important thing, because the corona or COVID-19 virus spreads from one human being to another human being. It doesn't spread through the other, inanimate objects. It spreads through one person to another person through their respiration, through their droplets. So what are the point of entry for that virus to get into your body is through your eyes, through your nose, and through your mouth. So these three things, they say there is a mnemonic for it is avoid men. Mouth and nose and eyes, men. So that we need to understand. So in order to sort of like stop it, what you need to do is you need to wear a mask which is very properly taken. Majority that this is called the surgical mask, and this is the N95 mask. This N95 mask is the best version because N95 reduces the chances of transmission of the virus up to 95%. All right. If two persons are wearing N95 mask and if they are maintaining a distance of 3 feet, there is very minimal chance of you getting an infection. That we need to understand. But you need to wear that mask very properly, and it should be snugly fit on your nose so that your nose is covered, your mouth is covered properly. And even if you take the lateral view of it, it is covered from the sideways as well. But many people I tend to see in the markets or in shopping malls or going outside, they tend to put it like this. Or whenever their friend or family members come, they try to open like this and try to speak, which is of no use. This is of no use, that you're not protecting yourself. It's a waste of resources if you wear the mask like this. So always wear the mask like this, properly, snugly fit, so that your nose and mouth are not exposed. That is the one thing. The next thing is the physical distancing. That is more important. Actually, the name has been given as social distancing, but actually it's physical distancing. At least 3 to 6 feet of physical distance you maintain and wear mask, the chances of transmission is very less. And the third thing is washing your hands. That is very, very important. The washing of hands it's not always to be done with the sanitizer or something like this. You can do it through soap and water, which is easily available most of the places. And you can use sanitizer if there is not available. The important thing is, even if there is a coronavirus now sitting on some pen or some table, even if you test that, and the coronavirus is there on your hands, and if you don't touch your eyes, nose, or mouth, it's not going to get into your body. That we need to understand. It's going to die even if it's just staying on your hand, because it needs a route of entry. If there is no route of entry, then it's not going to get into your body. If your skin is cut, if you're bleeding, then if a coronavirus sits on that, then probably there is a point of entry. But an intact skin will not allow the virus to get into your body. So that we need to understand. Why washing hands is important is that if you don't wash your hands, and if you sort of like try to touch your mouth, nose, and eyes, then you are giving that virus a gateway to get into your body. So don't touch until you wash your hands. The next foremost thing is vaccine, which we must congratulate the scientific community for this, because previously getting a vaccine was so difficult in the research related to it and the patent related to it, and getting to the public in general market used to take at least 5 to 10 years. This, because of this pandemic, scientists across the globe have worked very hard to get a vaccine for it, and many countries are doing really well. America is really doing very well about vaccine, and Israel has done really well about vaccine, and probably we are lagging behind the vaccination drive. If the more than 50% of our population is vaccinated, then probably there is a herd immunity which is getting in our system, that we all have herd immunity for polio now. That almost 90% of more than 90 to 100% of our population is vaccinated against polio. Now there is no fear of polio. Like that, if more than at least 50% is vaccinated quickly, then that will reduce the cases and reduce the mortality. These are the 4 important things what we have for prevention. And for prevention of mental health related issues, like what to do if you are locked down, what to do if you don't have a job, what to do, there is a seal down. All these things will be running on our mind. We need to understand that we need to think in a very out of box way, that necessity is the mother of invention. And we must always, suffice ourselves that nothing is permanent in this world, not even our worries. That we need to understand that, this is not going to last forever. We are going to win our battle against this pandemic. That hope should be there in our mind, and that courage to deal with this adversity should be there in mind. So that is the resilient mind, which can cope up with any kind of difficulties with a scientific approach, not an unscientific approach. That we need to be very clear in our minds. So in order to keep our mental health in a good way, what can we do? What we need to do is we need to maintain at least 1 hour of physical activity, at least 30 minutes to 1 hour. That is quite important, because when I was working in UK, in London, for mild depression or mild anxiety, there is something called National Institute of Clinical Excellence, NICE guidelines. That NICE guidelines gives guidelines for all disorders. For mild depression or anxiety, they used to say at least 30 minutes to 1 hour of physical activity will increase something called endorphins in our body, which is a natural antidepressant. You might do aerobics, you might do yoga, you might do jogging, skipping, whatever you like, please do it, so that your cardiometabolic rate is increased, so that it's not like a very slow walking. Your heart rate should go, you should start sweating. That is the way it should be done. I would not suggest a rigorous exercise for elderly people or those people who have some other medical problem. Young people should be able to do that, and elderly people and those who have some medical issues can do some brisk walking. That will help. And to maintain good mental health, what else you can do? You can read some motivational books. You can go through some life stories of great people like Abraham Lincoln, Abdul Kalam, or Vishweshwaraya, whoever has gone through a lot of difficulties in their childhood, but they still made it great in life. They couldn't get what they wanted, but they still made it great. I usually quote example of Michael Phelps, who is the Olympic gold medal winner, highest gold medal winner, who after participating in his first Olympics couldn't get a medal, was so depressed, so dejected that he wanted to kill himself. He locked himself in his room for almost a month. He was not interacting with his family or friends, anybody, and he was at the verge of committing suicide. But then one of his friends took him to a psychiatrist, got him counseled, got him some medication for as antidepressants, and he restarted practicing. He regained his self-confidence and motivation, that he restarted practicing in such a way that you would be found in only two places. One, either he was in his swimming pool or in his bed, so that he used to practice more than 12 to 16 hours per day. And the next Olympics, when he entered, he started winning medals like anything. Unstoppable he was winning medals in 100, 200, butterfly, 400, any event. And now he has become the highest gold medal winner in the history of Olympics. And now he is also promoted, is taken himself as a voluntary job as mental health advocate. He is supporting people who are having mental health illness, who are having depression, to overcome that, in supporting in giving counseling or taking them to appropriate medical facilities. So that we need to have, that you should have that hope in yourself, that you should never lose hope. And reads, or if you read, go through all these motivational stories. You can also go through motivational stories of people. A 100-year-old lady who had corona in Chitradurga, she recovered from COVID. And there are people, a small baby, just newly born baby who had COVID, recovered from COVID. And there is an army veteran in US who has seen World War I, World War II, and COVID pandemic, and he was positive about, he tested positive with COVID, he was admitted, and he came back normal. What we need to understand, that in your mind, that don't go with the unscientific advice, your WhatsApp forwards. What you need to understand, that even if you're testing positive, 95% of the time, nothing will happen. It is just a flu, 95% of the time. Only 5% will require hospital beds. And among that, 4% might require oxygen bed, and 3% might require an ICU bed, and only 1%, 1 to 1.5% people might die of COVID. That we need to understand. The mortality rate is not high when compared to things. If you take example, if somebody is having a heart attack or a stroke, the mortality rate is probably more than 10%, 10 to 20%, if they're not coming the right time. So COVID, you don't have to panic. You don't have to press that panic button. Oh, I'm tested positive for COVID, I'm going to die. It's not the case. The case, what you need to understand from doctors, from the scientific community, that 95% of the time you'll just have some fever, cold, you'll have some myalgia, muscle weakness, or some tiredness. You might lose a little bit of taste. That's it. You'll recover from that. That we need to understand, that information is quite important. The next thing is about building immunity. We need to have some good food, that we need to take care of ourselves, that fresh fruits and vegetables rich in vitamin C. What are we rich in vitamin C? Lemons are rich in vitamin C. Oranges are rich in vitamin C. That you need to take probably more. And what we use turmeric in our Indian curries, that is also quite good in order to have other zinc and other things. Okay. And vitamin D is getting yourself exposed to sunlight, and drinking milk or having egg will also help. Have fresh, protein rich as well as vitamin rich food, that we need to understand. Other things what we can do to maintain our good mental health is, you can involve yourself in meditation, as Bishop Francis told about the importance of meditation, that you sit quietly, do some deep breathing, and focus on your breathing. Take slow, controlled breathing. At the count of 7, you inhale and focus about your breathing. Hold it for 4 seconds and gradually release it. So the slow, controlled, deep breathing will help you to reduce your anxiety, little bit of depression, and get some peace of mind. At the same time, you can meditate with the name of Almighty. That will also give some kind of confidence in you, that there is someone with me. Next, apart from these things, what else can be done? When you are quarantined, or when you are locked down in the house, you can involve family members in some indoor games that will help to build some team building, as well as improve your confidence. Play some carom, chess, or some traditional games, that will also help. And you can always take it time positively, that you organize your room, organize your book, organize your life, that you sit quietly and think about your future goals. That, I never had time to self introspect myself, self analyze myself. What are my strengths? Something called SWOT analysis. You do your, what are your strengths, what are your weakness, what are your opportunities, what are your threat. If you do that, probably you'll come to some kind of self awareness about your own self, your life, and about your family. That how to organize your life in future, that will increase your self confidence and your mental health. The next thing is, what if something really goes wrong? That is about, if you're tested positive and you suddenly started having panic attack, and you suddenly started feeling that you're unable to sleep. First and foremost, keep that scientific knowledge, that scientific information in your mind, that getting positive is not the end of the world. Probably it is an indirect way of getting vaccinated as well, that there is an virus entering your body and your body is trying to fight with that virus and is trying to create antibodies. So nothing is really going to go wrong. If you're tested positive, follow the government guidelines about the medications, isolate yourself so that you don't spread the virus from yourself to your family members, and follow the medication regime, and be hopeful about the future that you will recover. You will be among that 95% that nothing will go wrong. And even something is going little bit haywire, you will recover, because only 1% is the mortality rate. That we need to understand. That information should always be lingering in your mind, that you should not go with the unscientific WhatsApp forwards or Facebook social media messages or what is bombarding in the television. You should not go with that. And the next thing is keeping your mind sane through, if you are already having anxiety, depression, if your doctor has prescribed some medication for anxiety, depression, you can take that medication along with the COVID medications. That we need to understand. If you can talk to your friends or family, ventilate your emotions, that I'm feeling low, I'm feeling dull, I'm feeling depressed, I'm feeling anxious. You talk to your friends and family, and if you're able to find some solace with them, if somebody is able to infuse confidence in you and you're able to recover from that, that's well and good. But if you're feeling terribly sad about yourself, if you're feeling terribly anxious about yourself, that no amount of talking to your friends or family is giving relief to you, then you require professional help. You need a psychiatrist, a psychologist to talk to you in a scientific way how to change your negative thinking pattern to positive thinking pattern. And maybe you might require some medication, because all causes of mental health issues are biopsychosocial in nature. That we need to understand. Biological is your genes and your neurochemicals in the brain. In our brain, there are certain neurochemicals called serotonin, dopamine, norepinephrine. In depression, what happens is, depression and anxiety, these levels go low. Just like in diabetes, the insulin level is low. The similar way in depression and anxiety, this serotonin or dopamine levels will go low. In psychosis, the dopamine levels will go high. So you need some medication which can control this, bring back the normalcy within your neurochemicals of the brain. Psychological is your thinking pattern. It's about how you think. For example, I usually tend to give an example where you walk into your office or college or your church, and you say somebody good morning, and that opposite person just walks away. How do you feel? A negative person might take it in a very different way. He might think that I'm not likable. Nobody likes me here. That's why the opposite person didn't wish me. So he will get that negative thought in his mind that I am not likable is the thought he gets. And what is the emotion connected to that? The emotion is depression. Oh, nobody likes me. I'm feeling terrible. I'm feeling sad. I'm feeling low. And what is the action to that is, if the same person whom you wished in the morning comes in front of you in the corridor in the evening, you will not wish him again. You'll just avoid that person, saying that, why should I wish a person who doesn't like me? Let me just go away from this place. But a positive person will think differently. A positive person might think that maybe the opposite person is absent-minded. That's why he didn't wish me. It's none of my fault. I have not done anything wrong with him. I am confident about my actions, my words, and my behavior. So why should I feel worried? Maybe he's absent-minded. He might require some help. So he will think in that positive way, and he will have that self-confidence intact, and his emotion is not depression, his emotion is self-confidence. What is the behavior? If the same person he sees in the evening, he'll just go to him and talk to him. He'll rebuild the bridges, saying that, hey, come on, this morning I wished you good morning, you didn't recognize me, come on, let's go for a coffee. So he tries to build the bridges. So this is how the thinking is connected. That is the root cause for all the emotion, that how you think. The situation is there, but what kind of inference you draw out of that situation all depends on your thinking. So positive thinking will have a totally different meaning to your adversities or difficulties or your situation, but a negative thinking can make hell out of heaven. That we need to understand, that you need to change. That is what we do in something called cognitive behavioral therapy, or CBT, which I told in the beginning, that your thought, emotion, and behavior are connected. We try to sit and talk with the patient, try to analyze we do thought processing, what all the thoughts they got in these situations and with these people, and how we should be able to deal, and how we can think of alternative thinking pattern in his mind, how we can think more positive of the situation, how we can focus on solution rather than problems, because many people will be so absorbed with the problems they are unable to think about the solutions. So you should be solution focused thinking. For example, a depressed person, how he'll think is, he'll think in black and white thinking, that either I'm good or bad. Or he might think in magnification or minimization. He might magnify his own past difficulties or past some small bad deeds what he has done. I couldn't help my father, I couldn't help my mother, or I had a quarrel with my friend, or I am a very bad person. But he might have helped that friend or his parents n number of times, but during the depressed state of mind, he'll forget all that. He will magnify his own small things of friction. He'll magnify in a big way, that he'll term himself as a bad person, and he'll minimize his achievements, or he'll minimize his helping nature, what he had done in the past. So that is the way the depressed mind thinks. So that we need to understand. And in an anxious mind, how the anxious mind thinks is in a catastrophic way. That, as I told you, if I'm having a headache, that person might think that I'm having some brain tumor. If I'm having some little bit of chest pain, that person might think I'm going to die of heart attack. I need to rush to hospital, check my ECG, check my echo. So this is the extreme negative response the mind gives when the person is anxious. So that we need to understand. So if it is not resolving with somebody's good talk or some compassion, you need to take some professional help. You need to go through some counseling or CBT. And if there is a severe problem, even if it's not coming under control with counseling or with CBT, then you might require medication. And people should not have negative notion about medication or about mental health. People think that if I take this medication, I might become addicted. All these things will be there. No, you need to understand that people are okay. This sort of questions were used to ask about tuberculosis or leprosy in the past. I should not take this medication. But now people are taking diabetes medication or hypertension medication for lifelong. Now they have come to that scientific understanding that is a chronic disorder, you need to take it. So for every disorder, there is some kind of a course. If you have a small cold and cough, the doctor will prescribe you for 5 days, not for 1 day, because the 5 days is the course. If you're having tuberculosis, the prescription will be for 6 months, because that is a course. If you're having some anxiety or depression, probably you might require medication for few months to maximum 1 year. After that, your psychiatrist will try to reduce the medication and try to stop it. That you need to understand that it is devoid of anybody's social economic status, or a small person or a big person or a normal person to a celebrity. Anybody can get anxiety or depression. You might have heard about Deepika Padukone getting depression, Hrithik Roshan getting depression, or Abraham Lincoln going through depression, or Winston Churchill, who was the Prime Minister of Britain, having bipolar disorder. So anybody can get it. So that we need to understand that taking medication should not be stigmatized. If required, that will help you to regain your insight, regain your confidence, and coming out of from addictive behaviors of alcohol or drugs or smoking, other things, it will put you back on track of your life. And it should not be stopped on your own. It should be consulted with the psychiatrist. And I was discussing with father, so he asked me to speak a little bit about how our people, that people working in churches, people who are in NGOs, helping people in difficulties or underprivileged people, how they can counsel. That we, along with many NGOs, we have started Shumaga Helping Hands now, so that if you get a call from a COVID positive person or a family member of a COVID person, how we can help them and how we can try to soothe their anxiety and depression. First and foremost, there are certain rules for counseling that we need to understand. There are some do's and don'ts for counseling. First and foremost is, whenever you're speaking to someone, you need to infuse confidence in them that this is confidential. That is the first and foremost foundation of counseling, that this is confidential, that whatever you discuss with me will be between me and you. I'm not going to discuss with my friends or family, or I'm not going to discuss over dinner or a coffee table that, oh, such and such person had come, they had, the husband and wife are fighting, that is the problem, somebody had an extramarital affair, or they're having some quarrel with their children, they're having financial difficulties. You are no one to discuss their personal affairs with somebody else. They have come to you with full faith and trust, and you must maintain that faith and trust. That is the basic medical etiquettes, that confidentiality is maintained. Then only the patient will open up. Because many times we tend to see that they will not disclose certain their childhood difficulties or some adverse incident which has happened in their younger days to their own family members, but they will disclose that to a therapist or to a psychiatrist. Why? Because we'll induce that confidence in them that whatever you discuss is confidential. So that confidentiality has to be maintained by you. And the next foremost thing about counseling is to allow them to ventilate, allow them to express, because counseling is more of listening rather than giving advice instantaneously. That is what happens with most of the undertrained counselors, that somebody comes with some problem, they instantly give the advice depending on their own personal experience. That should not happen. You should not disclose, oh, the same thing happened with my wife, the same thing happened with my children, and how I dealt. This is not counseling. This is more of a family chat or a friend chat. But in counseling, you have to listen to their problems, allow them to open up, allow them to find their own solution for their own problems. You need to make them more resourceful. There is an hidden talent, there is an hidden courage, hidden self-confidence within them, that they would have faced more difficulties in their past life, in their problems, and they would have overcome that difficulty. But now during the time of depression or anxiety, they are unable to cope up with that. So you need to regain that self-confidence in them, allow them to talk, allow them to express their difficult past. How did they cope with that? How did they overcome that? Give some neutral examples, which I did, some motivating examples about I just told you about Michael Phelps. I can quote numerous examples of people like Abdul Kalam wanted to become an Air Force pilot, like Abhinandan. He couldn't get it. He got a job in Ministry of Defense, but he accepted with a difficult heart. But later he passionately accepted it, and he became a nuclear scientist. He invented missiles, and he became president of India, and one of the best motivating presidents whom we all like. So there are so many people who didn't get what they wanted in life, but they accepted it and they became successful later on in life. So for that, you need to give some motivating examples to clients in a neutral ways, that you can get a learning point from their others' life. So in that way, you allow them to speak, allow them to ventilate. That will reduce their anxiety, that will reduce their depression, because ventilation is one of the best form of therapy. And don't jump into conclusion. Don't give a lot of personal information about your own life and your own experience. That might be correct or that might be incorrect way of dealing with it. You need to give some scientific advice or some psychological advice to them that, okay, if you feel that the person during your conversation saying that, oh, I feel just like giving up my life, I'm having suicidal thoughts. Yesterday, I tried to kill myself by taking tablets or try to hang myself. Then you need to be alert that this is beyond a lay counselor's ability. You need to refer them to a psychiatrist for further help, because 90% of the people who commit suicide would have expressed that suicidal thought before to somebody, and majority of the times it's neglected. They say that, oh, nothing will happen, don't worry. No, they will just say it like that. You need to understand that, is it a normal anxiety or a normal sadness, or it is a syndromal depression or a syndromal anxiety. If somebody is having expressing suicidal thoughts, you need to take more information whether the person tried to act upon suicidal thoughts, or is it just a thought, or did he act upon it. If he tried to act, did he take that tablet when nobody was there in the house, or did he try to take the tablet in front of people? He just took 2 tablets for the attention seeking. So there is a difference between attention seeking parasuicidal behavior to a actual suicidal behavior, where the person will write a suicidal note, will try to hoard tablets for few days, and try to make an attempt, in a serious attempt, that he will not take 2 tablets, he will take 100 tablets. And he will try to make sure that he cannot be rescued. He will try to make sure that nobody is there at home, his phone is switched off, or all other things, so that he has given away his, money or gifts or watch or pen to someone, that he is, trying to plan for suicide. So there is something serious about it, that you need to ask more questions. How did he try to do that? So did he do it in some in the past as well? If somebody is having a suicidal attempt in the past 6 months or 1 year ago, you need to be more cautious. But how you ask that question, that is also quite crucial. That you can't ask, do you feel like dying? You can't really ask that question on the face. You need to ask in a very sensitive way that, I tend to see a lot of clients, or I speak to a lot of people. Some people, when they are in real depression or in real anxiety, they might feel like life is not worth living. Do you feel so? If you ask like this, then probably the person might come up. They say, yes, I do also feel like that. Instead of directly asking, do you feel like dying? Do you feel like committing suicide? That's not the way it should be asked. It should be asked in a cushioned way, that they won't feel hurt. They won't feel guilty that they are having that thought. It's their depressed mind which is making them to feel like that. So you need to ask that question in a very, very controlled way. So once you ask that, you need to ask more details about it, about their sleep, about their negative thinking pattern, what support system they have. So your confidentiality can be broken. That you need to understand. If something serious is going to happen, if the risk assessment, what we call it, if there is risk to self, risk to others, or risk to the community. If somebody is having a thought, that a paranoid thought, that anyway, I'm going to die, I'm going to kill my neighbor who always troubled me. So if you feel that, then you need to get those family members into confidence, that you can break that confidentiality, saying that, can I speak to your husband, or can I speak to your father? Can I speak to somebody who's close to you? Then you can break that confidentiality, not saying all the personal details, at least saying that this person is really depressed. This person is having suicidal thought. This person is having also homicidal or paranoid thoughts. He's risk to himself or risk to others. You need to take him to a doctor, or you need to take him to a psychiatrist. Then the confidentiality can be broken. Not all small personal issues, that he's having some some financial difficulties, or some marital issues, or some extramarital issues, that and all you are not supposed to disclose. That you need to understand, that confidentiality can be broken in certain times. That is accepted. That you should not feel guilty about breaking that confidentiality. And there are some legal issues and medical legal things as well, because it becomes an utmost criteria that if you come across somebody, if a child expresses that she was sexually abused by his uncle, or during the pandemic times or during the lockdown, it's usually the near and dear who try to physically abuse or mentally torture or sexual abuse or punish the underprivileged people like children or elderly people. They might be at the risk of getting abused. If you get to know about that during your counseling session, then you need to inform the authorities. That should be very clear, that you need to inform the child social welfare department or child department, or you can inform the police as well, that this person was abused in such a way, and there is a protocol for how you need to fill the form and how you can give evidence, so that you can be kept anonymous while the person is disclosing the information to the authorities, and the child is also protected. The child is not given back to the abuser, because many times what happens is the child or the elderly person might have come with the abuser himself to your counseling session or to your clinic, that he might be sitting in the waiting area, and this person is telling that the person sitting in the waiting area is the actual person who has done all nasty things with me. So you need to be quite careful how to deal certain things. But if you feel that this is beyond my capacity or beyond your professional abilities, then you need to refer them to a psychiatrist or a mental health professional who is more experienced in dealing with this. So these are all the issues. But what we need to understand at the end of the day is mind is more resourceful. We have got 100 billion neurons in our brain. And there is something called neuroplasticity, that every day we tend to learn new things, and our neuronal connection trying to have synapses, that one neuron is connected to another neuron. If you start thinking in a positive way, if you start discussing about issues, if you start getting scientific knowledge, and if you are playing, doing physical activity, your neuronal growth will also be there. So your memory will improve, your self-confidence will improve, and your brain has that capacity to overcome adversities. The brain is resilient, but we make it ourselves weak. That something goes wrong, we need to be sad, we need to be depressed, we need to kill ourselves, we need to give away hope, or that we need to put a break, that our mind is playing tricks on us. Why can't I regain my self-confidence? Why can't I get back to my original self, which is capable of dealing any adversities in life? And why can't I get a professional help for it? So if you think in these ways, prevention as well as, if something really goes wrong, what kind of treatment, all in biological ways, psychological ways, and sociological ways. So with this, I end my talk. I invite people to ask questions, and somebody can moderate those questions. Thank you so much. Thank you.
Thank you, Dr. Arvind, for the motivational talk, maybe much inspiring talk, and from the few comments found in the chat box, I think it was really inspiring, motivational, and maybe it has given some kind of opening for us, for all of us, to face the situation in a better way than what we used to look for. Maybe it has given us some motivation to be positive. So maybe for a few minutes we can take up a few questions if there are any, or we can just wind up. Those who want to ask questions can just raise their hands, unmute the mic, and yes.
Thanks for those wonderful comments. I want it to be more interactive, because because I can't cover everything in 1 hour. There might be some questions in your mind. Maybe the doctor didn't cover this, or this is the doubt I have, or my relatives, or about your friends. Please do ask.
Yes.
What is the use of injection?
What injection, ma'am?
COVID injection.
You mean to say vaccination? Vaccination is quite very important, because it produces antibodies in you, and that is the only protective measure we have got. We don't have a specific medicine for, as of now, for COVID. There is no specific a tablet or an injection which can cure. Like, for example, you have insulin for diabetes, or you have anti-tubercular medication which can kill the bacteria. But for this kind of virus, there is no specific medication. Vaccination is a very preventive strategy. So once you get a vaccination, the first dose of vaccination and the second dose of vaccination, after the second dose of vaccination, you will have an antibodies, that the antibodies will fight against the coronavirus if you get infected. that will remain for several months. As of now, 3 to 6 months it will be there, so you're more protected. But even if you're getting vaccinated, do not lose your guard. That do not become relaxed, that, oh no, I've got vaccinated, why should I wear mask, why should I maintain physical distancing? Don't do that, because people can still get COVID even after vaccination. But what is the advantage is that the severity is less. We are seeing cases where people who have got 2 doses of vaccine, the mortality rate is very negligible. As I told, if you are getting COVID without vaccination, the mortality rate is 1 to 1.5%. Mortality is a risk of death. So if 100 people get COVID without vaccination, maybe 1 or 2 people might die. If 100 people who are vaccinated against COVID, they have got 2 vaccines, and if they get COVID, the chances of death is very negligible. They're just 0.1%. Chances of getting hospitalized or chances of you going on ventilator is also very negligible, because your body is also already producing antibodies for it.
Thank you, doctor. Are there any
Hello.
other? Hello.
Hello.
Hello, it is William Martin. Yes.
Yeah, I am asking in a question.
Kannada. Yeah, Kannada you can.
Kannada, okay. Sir, ಆಕ್ಸಿಜನ್ ಡೌನ್ ಆಗತ್ತೆ ಅಂತಲ್ರ, ಅದು ಹೇಗೆ ಅಂತೇಳಿ ಗೊತ್ತಾಗ್ತಾ ಇಲ್ಲ.
ಆಕ್ಸಿಜನ್ ಅಂತ ಹೇಳಿದ್ರೆ, ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ನಮಗೆ ಯೂಶಲಿ ನಲ್ಲಿ ಪಲ್ಸ್ ಆಕ್ಸಿಮೀಟರ್ ಅಂತ ಇರುತ್ತೆ. ದಿಸ್ ಇಸ್ ದಿ ಪಲ್ಸ್ ಆಕ್ಸಿಮೀಟರ್, ರೈಟ್? ಸೊ ಇಲ್ಲಿ ನಾವು ಇದು ಬದಲಲ್ಲಿ ಇಟ್ಕೊಂಡಾಗ ನಾವ್ ಇಲ್ಲಿ ಆನ್ ಮಾಡಿದ್ರೆ ಏನಾಗ್ತದೆ ಅಂತ ಹೇಳಿದ್ರೆ, ನಮ್ ಬಾಡಿಯಲ್ಲಿ ಯೂಶಲಿ SpO2 ಅಂತ ಹೇಳ್ತೀವಿ. SpO2 ಅಂತ ಹೇಳಿದ್ರೆ ಆಕ್ಸಿಜನ್ ಸ್ಯಾಚುರೇಷನ್ ಇನ್ ಯುವರ್ ಬ್ಲಡ್. ಅದು ಯೂಶಲಿ 95 ಮೇಲ್ ಇರ್ಬೇಕು. ಅಂದ್ರೆ ಈಗ ನಂದು 100% ತೋರಿಸ್ತದೆ, ಇಲ್ಲಿ ಮೇಲ್ ನಿಮ್ಗೆ ಕಾಣಿಸ್ತಾ ಇರ್ಬೋದು. ಈ ಪಲ್ಸ್ ಆಕ್ಸಿಮೀಟರ್ ಅಲ್ಲಿ ಮೇಲ್ಗಡೆ SpO2 ಅಂತ ತೋರಿಸ್ತದೆ, ಕೆಳಗಡೆ ಪಲ್ಸ್ ಹಾರ್ಟ್ ರೇಟ್ 76 ಬರ್ತಾ ಇದೆ, SpO2 100% ಇದೆ. ಓಕೆ, ಸೊ ಇಲ್ಲಿ ಕೊರೋನಾ ವೈರಸ್ ಅನ್ನೋದು ಮೆಜಾರಿಟಿ ಅದು ಲಂಗ್ಸ್ ಗೆ ಹೋಗಿ ಎಫೆಕ್ಟ್ ಆಗುತ್ತೆ. ನಮ್ಮ ಶ್ವಾಸಕೋಶ ಏನಿರ್ತದಲ್ಲ ಅಲ್ಲಿ ಅಟ್ಯಾಕ್ ಮಾಡುತ್ತೆ. ಅಟ್ಯಾಕ್ ನಿಮೋನಿಯಾ ಕ್ರಿಯೇಟ್ ಮಾಡುತ್ತೆ. ನಿಮೋನಿಯಾ ಅಂತ ಹೇಳಿದ್ರೆ ಒಂದು ಬಲೂನ್ ಅಲ್ಲಿ ಎಷ್ಟು ಗಾಳಿ ತುಂಬೋದು ಅಷ್ಟು ಚೆನ್ನಾಗಿ ಗಾಳಿ ತುಂಬೋದು. ಆದ್ರೆ ಬಲೂನಿಗೆ ಒಳಗಡೆ ಹೋಗಿ ನೀರು ಅಥವಾ ಮಣ್ಣು ಹೋಗಿ ಕೂತ್ರೆ ಎಲ್ಲಾ ಕಡೆ ಗಾಳಿ ತುಂಬೋದಿಲ್ಲ. ಸೊ ಹಾಗಾಗಿ ಈ ನಿಮೋನಿಯಾ ಅಂತಕ್ಕಂಥದ್ದು ನಿಮ್ ಲಂಗ್ಸ್ ನ ಒಂದು ಬಲೂನ್ ತರ ಫ್ರೀ ಆಗಿ ಮೂವ್ ಮಾಡಿ ಗಾಳಿನ ಫುಲ್ ತಗೊಳ್ಬೇಕಾಗುತ್ತೆ. ತಗೊಂಡ್ಬಿಟ್ಟು ಎಕ್ಸೇಲ್ ಇನ್ಹೇಲ್ ಮಾಡ್ಬೇಕಾಗುತ್ತೆ. ಕೋವಿಡ್ ಏನ್ ಮಾಡುತ್ತೆ, ಅದು ನಿಮೋನಿಯಾ ತರ ಮಾಡುತ್ತೆ. ಅದು ಎಕ್ಸ್ಟೆನ್ಷನ್ ಆಗೋದಿಲ್ಲ, ಅದಂತ ಕ್ರಂಪಲ್ಡ್ ಆಗುತ್ತೆ. ನಿಮ್ ಆಕ್ಸಿಜನ್ ಸ್ಯಾಚುರೇಷನ್ 95ಗಿಂತ ಕೆಳಗೆ ಬರ್ಲಿಕ್ಕೆ ಶುರು ಆಗುತ್ತೆ, 94ಗಿಂತ ಕೆಳಗೆ ಬರ್ಲಿಕ್ಕೆ ಶುರು ಆಗುತ್ತೆ. ಅವಾಗ ಪ್ರಾಬಬಲಿ ನಿಮಗೆ ಆಕ್ಸಿಜನ್ ಹೊರಗಡೆಯಿಂದ ಕೊಡ್ಬೇಕಾಗುತ್ತೆ. ತುಂಬಾ ಕಡಿಮೆ ಆದಾಗ ವೆಂಟಿಲೇಟರ್, ಕೃತಕ ನಿಮ್ ಬ್ರೀದಿಂಗೇ ಮಾಡಕ್ ಆಗ್ತಾ ಇಲ್ಲ, ನಿಮ್ ಬಾಡಿಯಿಂದ ನಿಮ್ ಚೆಸ್ಟ್ ಮೂವ್ಮೆಂಟ್ಸ್ ಬರ್ತಾ ಇಲ್ಲ ಅಂದಾಗ ಅವಾಗ ವೆಂಟಿಲೇಟರ್ಗೆ ಹೋಗ್ಬೇಕಾಗತ್ತೆ. ಮಿಷಿನ್ ನಿಮ್ಗೆ ಬ್ರೀದ್ ಮಾಡಿಸುತ್ತೆ.
ನ್ಯಾಚುರಲ್ ಆಕ್ಸಿಜನ್ ಆಗೋದಿಲ್ಲ.
ಇಲ್ಲ, ಬಿಕಾಸ್ ನಿಮ್ ಲಂಗ್ಸ್ ಡ್ಯಾಮೇಜ್ ಆಗಿರೋದ್ರಿಂದ ಅದು ಕೆಪಾಸಿಟಿ ಇರೋದಿಲ್ಲ, ಅಷ್ಟೊಂದು ಆಕ್ಸಿಜನ್ ತಗೊಳ್ಲಿಕ್ಕೂ ಮತ್ತೆ ಇಟ್ಕೊಳ್ಳಿಕ್ಕೆ ಅದಷ್ಟು ಕೆಪಾಸಿಟಿ ಇರೋದಿಲ್ಲ.
ಥ್ಯಾಂಕ್ ಯು.
Yeah, doctor, there is one question in the chat box by Sister Mari Evelyn, which reads, Doctor, scientifically 1% is at risk, but the reality is 10 times more deaths take place. How do we reconcile?
ಆನ್ಸರ್ ಕೇಳೋದನ್ನ
How do we reconcile with this reality?
Yes, there are certain questions as well. Like there is some rare incidents of happy hypoxia. Happy hypoxia is whenever the oxygen saturation is going low, you will feel breathing difficulty. Your chest is going tight. You are unable to breathe smoothly, because breathing is an automatic phenomenon. You don't have to concentrate on a breathing. When I'm talking, I'm still breathing. When I'm sleeping, I'm still breathing. I don't have to focus on my breathing. But when you are having COVID and your oxygen saturation is going low, you'll feel the difficulty in breathing. You'll feel that it's very hard to take breath and exhale and inhale. So this, in some cases in COVID, there is something called happy hypoxia, where your oxygen saturation is going down, but you're still not feeling that breathing difficulty. You're not sensing that. Even when the oxygen saturation is 80, you're normal. So that's why you need to have that pulse oximeter whenever the person is positive of COVID. Then you need to monitor your SpO2. If your SpO2 is going low and you're still not having any difficulty, you need to immediately go to a doctor. That you need to understand. And there are certain issues with reporting about deaths, because many times what happens is that many people don't go to doctors, they don't get tested for COVID and they still die. They might be having COVID positive, but they have not got themselves tested and they suddenly succumb to death. So in those cases, probably they might also be considered as COVID deaths. That you need to understand. There was higher mortality when initially it struck Italy. The mortality was almost like 8 to 9%. That was quite high. And in the worst possible in January this 2021 in America, the mortality per day almost reached more than nearly almost 4,500. We are seeing similar figures now, because India is a huge country, almost like 130 crore population. We have sort of like the mortality rate now around, we have lost more than 2.5 to 3 lakh people almost. So the rates might be high if you're not testing people, that you're not tested people and somebody dies. And how do you come to conclusion that it's a corona death, it's a COVID death? So you need to test more people, then only you'll come to know whether the death was due to COVID or not, a non-COVID death.
Yeah.
How does the corona act through the eyes?
Sorry?
How does the corona act through the eyes?
Eyes.
Yes,
Eyes, you mean?
yes.
Okay, corona can infect any part of your body, but it's very rare that it infects your eyes. Majority of the times it infects your lungs and your neuronal system. That people are having sudden heart attack, sudden stroke after having COVID, because it is causing something called cytokinin storm. That there are certain blood cells in your body like platelets, neutrophils, all of the things. They start getting accumulated, just like you are getting accumulated of a thick kind of like a fungus, what you get in the pipes, that pachi anta ಏನು ಕೇಳ್ತೀವಲ್ಲ ಆ ತರ you might get this aggregates of blood cells in one place, so that the blood circulation to your heart and your brain is stopped, and suddenly the people might have stroke or heart attack. Eyes, again, it can go through the vascular system. The blood circulation through the eyes can also affect, it can affect retina, and people might cause blindness.
Hello.
So, but it's very rare to affect the eyes.
Thank you, sir.
Thank you.
There are one or two questions. There are one or two questions in the chat box. That one question is, which vaccine is the best? I don't think doctor can.
Sure.
Call on yeah.
See, there is no sort of like evidence which is superior that the Sputnik V is best, or this Covishield is best, or Covaxin is best. Because it's all still early, because for a scientific community to come to a conclusion, we need to do longitudinal studies. That taken a Covaxin or a Covishield, and what is the antibody levels in them. It all depends on control study, that you take 1,000 people who have taken Covaxin and 1,000 people who have taken Covishield, or 1,000 people who have taken Sputnik vaccine, and you compare them after 4 weeks, 8 weeks, 12 weeks, or 3 months, 6 months. You do antibody testing. As of now, there is no such specific testing which has compared both 2 or 3 vaccine at once. But most of them, which we have got approval from the WHO, World Health Organization, all of them are proving to be effective. The Covaxin is effective. The Covishield is also effective, which is coming. Sputnik V, probably the only problem with Sputnik V is it needs to be maintained in a very low temperature, which is a challenge to a tropical country like India, where which is hot and humid. And there are questions about, black fungus.
Yeah, maybe.
Let's give.
Black fungus is, what we need to understand is, there is certain misuse of steroids. Steroids is a kind of like injection which is given in life-threatening conditions. Some people have started taking through WhatsApp messages or Facebook. They go and buy steroid injections or steroid tablets from the medical shops, and they're taking, once they're getting positive, they started taking steroid tablets, saying that it will help me. So abuse of steroid injections or steroid medications and overuse in the medical community by the doctors will also have a negative impact, because the fungus is always in our body, the bacteria is always in our body. It will only come to the surface, it will only come to action when your immunity gets low. Steroids will, in certain cases, will reduce your immunity, and your fungus will start growing more and more. So we should stop abusing of over-the-counter medication and steroids.
Doctor, I have a problem. During the day, I am all right. But when I go to sleep, lockout and all the consequence of lockout, children being at home, not having exams, and parents have no work, all these kind of things come to my mind and disturb my sleep.
Okay. See, the thing is, sleep is a time where it's more quiet, and you have probably some people will have more time to think. What we need to understand in sleep hygiene is that we need to have a good disciplined lifestyle. We need to do some physical activity at least for 30 minutes to 1 hour to get a good sleep. You should not sleep in the afternoon or daytime. And in the night, you should not have heavy meals. That is one thing. And you should switch off your mobile television 1 hour before going to bed, because people tend to listen to those news channels, other things, the death numbers and horrific scenes of crematorium and the ICUs, and they get terrified, because that is a time when you should have some pleasant things when you're going to bed. You should not hear to horrific things when you're going to bed. So they always say you should never take your worries to bed. If something is running in your mind, talk to someone, discuss with yourself, and try to find solutions for that before going to bed. When you put your head on the pillow, you should forget about it, that I should have a good night's sleep now. Or if you're not getting sleep, even after that, you get up and read something. You can read some stories or some Bible stories, other things which is in the small print that will induce sleep to you, and you can go back to sleep. And if even after doing all this, your brain is not allowing you to sleep, then there is some problem in reticular activating system in your brain that you might require some medications to relax yourself to help you sleep.
Thank you, doctor.
Yeah, so the last question. Hello. The last question from Annamma, ODP, Mysore.
Good evening. Yes, sir. Yeah. Good evening, doctor.
Very good evening, ma'am.
Yeah, this was a very, very nice talk. I really enjoyed your talk, and very useful also, doctor. The one thing what I need to ask is, see, people nowadays they started saying that to drink lot of hot water, drink lot of hot water, drink kashaya, drink that, drink this, it. So this has become a big headache. Really, I'm confused how much hot water to drink, and how much what is this kashayam, what kind of kashayas to drink, and eat lavanga, eat ginger, eat pepper. So this, how really to manage all this thing, doctor?
Yeah, that is very practical question what you asked, and thank you so much for the positive feedback.
Hello.
Thank you so much for that positive feedback. Your question is very practical. So the thing is, first and foremost, one to understand that any warm water or lukewarm water, what we say, is better than the cold water. Because lukewarm water, you boil it, then it is getting cold, then you consume it. So if there is any kind of like bacteria or some little bit of virus, anything is there in the water, the boiling water will destroy everything. So that is more safe. So the thing is, there is no such guidelines from WHO or from ICMR from the institution that you need to drink this liters of hot water. That is not the case. Usually 1 to 2 liters of water is what is required for a human being, that you can take. At least minimum of 1 liter and maximum of 2 liters. And if you have some kidney issues or some heart issues, then your doctor will advise whether to drink less or drink more. And regarding this kashayas and other things, what we need to understand that there are a lot of fake things which is running in the society. Last year, somebody came up with some tablets which was not scientifically approved at all, and somebody came with some coronil tablets. some person came, Baba Ramdev came, but it is not scientifically approved. It is not scientifically approved with WHO. That we need to understand. That you need to ask whether this medication is approved by the government, whether this medication is approved by WHO. That question we, as a scientific learned person, we need to ask. And regarding this kashayas and everything, if you are having an habit of taking kashayas in small quantities, like for example, some 20-30 ml of a small half cup of kashaya, that is fine. Because some people are taking too much, they're drinking morning, afternoon, evening, or every hour taking some kashayas. What will happen? That it will have an impact on your gastrointestinal system. You'll start having acidity, you'll start having burning sensation, you'll start having vomiting. See, the vitamin C and zinc and vitamin D, these are all available naturally to us in our own food. As I told, you take oranges, you take lemon, there is vitamin C there. You just take probably, 1/2 lemon, you put it, have a lemon juice once a day, that's fine. You eat some half orange, that is fine. And you take milk, you take boiled eggs, there is a lot of calcium, vitamin D there. And if you use turmeric in our curries, there's all you're getting there. You use ginger, garlic, and turmeric. So everything is there already. You don't need to have extra. But if you feel that you need to have some specific vitamin for yourself, there is something called Ceylon tablet is there. Ceylon is the tablet which contains vitamin C, zinc, and vitamin D in appropriate measures. So that if you're worried about how much quantity of kashaya or how much quantity of vitamins you need to take and how much is appropriate, which is very difficult to measure, there are certain tablets which is approved, which contains good quantity of vitamin C, vitamin D, and zinc. So that is called Ceylon tablet is there. Or normal tablet like Neurobion tablet, multivitamin tablet like Bicozules or Bicostars, they also contain good amount of all vitamins.
I think we have spent enough and more time, and there are quite a few questions coming up in the chat box, but I think it is time for us to wind up. And for those who want to have more discussion with Dr. Arvind, he is available at Positive Mind Clinic at Durgigudi, Shimoga. So you can always contact him or visit the clinic for more consultation, and is always available and is ready to help out different groups whenever his help is sought for. So dear doctor, on behalf of Bishop Francis Serrao, I sincerely thank you for sparing your time for us and giving this valuable information, motivation, which I think has given some energy to everyone to work to fight the present pandemic in a positive way. Once again, thank you, Dr. Arvind.
Thank you so much. Thank you. Good night, everyone. Thank you.
Thank
Bye.
you.
Yeah, Bishop,
Thank you, Doctor.
Bishop, and thank you. Yeah. Thank you, everyone, for participating.
Thank you, everyone. Good night. Sweet dreams.
And have a pleasant night. Thank you.
Good night.
Thank you.
Good night.
Thank you.
Thank you.